Thank you for listening to Depictions Media Radio.
Hola a todos y muy buenos días desde Washington, D.C. en los Estados Unidos.
Good morning, everyone, and welcome from Washington, D.C. in the U.S. Thank you for joining us in this press briefing on the COVID-19 pandemic in the region of the Americas. I am Sebastián Oliel from the Department of Communications of PAHO, and as every week, we will have from 45 minutes to 1 hour in this session, and we will take your questions to that point. We have already received some questions by email, and you will be able to ask your questions live and also through the Q&A button. Also, always remember to include your name and last name and your medium. We also have simultaneous interpretation into English and Spanish, Portuguese and French, and you will be able to use the interpretation through the interpretation globe. Dr. Carissa Etienne, Director of PAHO, will talk about the epidemiological status and we'll talk about the COVAX facility and our region's access to it. We have Dr. Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies of PAHO, and Dr. Sylvain Alighieri, Incident Manager at PAHO as well. Now, I would invite Dr. Etienne to share her words with us. Dr. Etienne, please. Over.
Thank you, Sebastian. Good morning, and thank you for joining today's press briefing. Over the last week, more than 1.2 million people in the Americas were infected with COVID-19, and 39,000 died because of the virus. And while these numbers are staggering, they represent a 10% drop from weeks past. Proof that public health interventions are helping us keep the virus at bay. Across North America, new infections are declining, giving hospitals much needed reprieve. Every country in Central America is also experiencing reductions in cases, except for Honduras, which throughout 2021 has consistently reported a rise in infections. In South America, Uruguay is finally seeing a dip in cases after a difficult start to the year. And while most countries are reporting downward trends, there are a few hotspots, particularly near the border between Peru, Colombia, and Brazil. In the Caribbean, larger, more populous islands like the Dominican Republic continue to drive new infections in the region. Although smaller islands like Aruba, Barbados, St. Lucia, and St. Vincent and the Grenadines are reporting an increase in cases. 2 months since the first COVID-19 vaccine was delivered, nearly 63 million people have been vaccinated against COVID-19 across the Americas and the Caribbean, with more people protected every day. The majority of these vaccinated are from the northern countries. And while these figures are encouraging, they are not enough. To benefit from the collective immunity of vaccines, herd immunity, coverage must be very high. More than 700 million persons throughout the Americas would have to be vaccinated against COVID-19 to ensure a 70% coverage. This will be no easy task, so we count on the full commitment of our member states and the global community to protect the peoples of the Americas. We are working with COVAX to bring us closer to this goal. But we must also urge donors, pharmaceutical companies, and international organizations to support the Americas so that we have enough vaccines to do what we do best: expand immunizations to save lives. Our vaccination goals in the region are grounded in equity. Everyone, regardless of who they are or where they live, should have access to a COVID-19 vaccine. As we start delivering COVAX vaccines, and as we prepare for the steep scale up ahead, we must be guided by our vision of fair and equitable access at every step of the way. We must overcome the structural barriers that prevent the most vulnerable from being immunized, and we can only do that by working together. We urge all countries to act quickly, be ready, and save lives. And we are already making progress. On Monday, we reached a critical milestone after the WHO issued an emergency use license for 2 versions of the Oxford AstraZeneca vaccines, one from AstraZeneca SK Bio of South Korea and the other from the Serum Institute of India. This international stamp of approval certifies that the vaccine is safe, effective, and ready to be deployed everywhere. The Oxford AstraZeneca vaccine can be stored at normal refrigerator temperatures and therefore seamlessly incorporated into our region's existing immunization infrastructure. In the next few days and weeks, countries participating in COVAX will receive confirmation of the timeline and number of doses for their first shipments from COVAX. Since the global supply of COVID-19 vaccines remains limited, countries should expect that these first deployments would be small. Around 160 million doses will be distributed in our region in the first semester, with doses ramping up every month. Rest assured, PAHO is doing everything it can to expand vaccine availability and to get vaccines out quickly. To make the most of these early doses, we urge countries to prioritize health workers and those at greatest risk, like the elderly, to decrease the burden on our hospitals, reduce deaths, and save lives. These first doses will also allow countries to test their immunization systems and overcome barriers before more doses are rolled out. We will have challenges. We will face barriers. We will see new problems, but we will overcome them by working together. PAHO is working nonstop to ensure that our member states are prepared for the arrival of vaccines. For months, PAHO has negotiated directly with manufacturers to streamline agreements on behalf of the COVAX mechanism and to reduce the burden on national governments. PAHO has worked with WHO, UNICEF, and the World Bank to set up a vaccine introduction readiness tool, best known as VRAT. It is a self-assessment platform that is used by over 31 countries in our region. Introducing a new vaccine is not easy. So PAHO has distributed guidance documents, held training sessions, and provided direct advice to countries across our region. We are supporting countries on everything, from logistics to coordinate the delivery of doses, to public information campaigns to ensure that people know where, when, and how to receive their vaccines. Our region is working hard to ready itself for the arrival of COVAX vaccines. The 10 countries that have qualified to receive doses at no cost are ready for their first shipments, and 27 others that will be purchasing vaccines through COVAX are nearly there. But there are two pending responsibilities that I wish to draw your attention to everywhere. The first, ensuring that countries have the legal and regulatory frameworks required to deliver these vaccines. Because these vaccines are new, they need to be approved for use in every country. Each country has its own laws and regulations. So we urge ministries of health, regulatory agencies, and other officials to review requirements for each COVAX vaccine to avoid delays in shipments. The second, ensure that countries have hired and trained the staff necessary to conduct mass immunizations. We are at the start of one of the largest immunization campaigns in our lifetime, an ambitious effort that requires health workers and other sectors to work together. Quite unlike our typical immunization drives that focus on children, COVID-19 vaccines will be rolled out to adults and the elderly first, requiring a different strategy. And each vaccine must be handled and administered differently. Preparing for this will take time, so we urge all countries to act quickly. These steps are the foundation that will allow us to quickly expand access when millions more vaccines reach our countries. Over the coming days, countries will face important tasks as they prepare for the arrival of vaccine doses. Any small delay could set vaccinations back weeks, so countries must make vaccine readiness their number one priority at this time. PAHO stands with our countries to provide any support needed today, tomorrow, and into the future. Just as we have done with smallpox, polio, and measles, we must make certain that everyone who needs a COVID-19 vaccine can get one. Ensuring the entire region has access to COVID-19 vaccine is not just our vision, it is our mandate. We urge every country to act quickly on the first vaccines and be ready for the longer road towards vaccine equity so we can save lives. Thank you.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a las preguntas y respuestas.
Thank you, Dr. Etienne. Now we will go to our question and answer session, and you can also use the Q&A, and please say your name and medium. First question is in English, and it comes from Jacqueline Charles from Miami Herald, and it reads:
Provided more than 170,000 doses of the AstraZeneca vaccine to Barbados, Antigua, and Dominica, which says it will share some of its doses with others in the Organization of Eastern Caribbean States. What is PAHO's reaction? Does this indicate that Caribbean countries aren't waiting on COVAX? Dr. Etienne?
Thank you, Jacqueline, for this question. Really, the world needs all the vaccines it can get. So we thank the government of India for this gesture, and we commend the governments of Barbados and Dominica for sharing with other countries. This is a small, but I think a significant example of the very solidarity that we need for all people everywhere to have timely access to safe and effective vaccines. But this act of sharing must be multiplied several times over. We call on all rich countries to act quickly so that all countries have access to the COVID vaccines. Remember, you are not safe until all are safe. Countries should really take advantage of the vaccine supplies available on the advice of their national drug regulatory authorities. Of course, PAHO has worked diligently to ensure that all countries in our region could access COVID vaccines, including countries that would not easily have a sit at the negotiating table with global suppliers. So while COVAX vaccine is not the only avenue that countries have to access vaccines, it is the only one working to ensure that the doses are rolled out fairly and equitably, irrespective of a country's income. So 10 countries in our region, as we have said, will receive COVID vaccines at no cost through COVAX. Unlike bilateral deals, COVAX will deliver vaccines to participating countries virtually at the same time and in the shortest time ever for poor countries. And this is unprecedented. In the short term, we know that there are simply not enough vaccines available to protect everyone right now. And this is true everywhere around the world. So countries need to share the available doses, and I again commend the government of India. And there is no better way to do this than through COVAX, a global coalition with clear and transparent criteria. All COVAX participation countries will get the vaccines that they've signed up for. More than 280 million doses of the COVID vaccines will arrive in our region this year. And as the vaccine supplies catch up with demand, countries need to be ready to ramp up their immunization campaigns, just as we will be ready to support them through COVAX, through our revolving fund, and with all of PAHO's capacities. Over.
Gracias, doctora Etienne. La siguiente pregunta es de Nicolás Luco Rojas.
Thank you. Next question from Nicolás Rudo Rojas from El Mercurio, Chile, and it reads, Chile is being commended for their efforts to quickly vaccinate their countries, but we are then emphasizing the migration from other countries, the dilemma of vaccinating or not vaccinating those who migrate. Is this a human rights situation? Some people in Chile say that sometimes there is no consideration about the monetary price invested by the country. And is it fair for the elderly and others in Chile and then to have to vaccinate migrants too? Dr. Barbosa, thank you for your question. It is very important to commend Chile and the efforts of other countries to have access to the vaccine. The vaccines are still limited in the whole world, so it is very important to guarantee that vaccination can occur according to the national immunization plan, seeking to vaccinate first those who are more vulnerable and the elderly and other adults with chronic disease to save lives. So this is the first objective of vaccination, of course, vaccinating health workers. But there are two situations to analyze here. First of all, that each country has their own laws and regulations, health systems. And in the situation of migrants, for us, it is evident that they need to have access to the vaccine. This is an obligation, a humanitarian, ethical, moral mandate, but also from the health standpoint, if we do not guarantee vaccination to migrants, then the population as a whole won't be protected. So this is regarding the migrants. Now, regarding the vaccination mechanism, we do not recommend for people to go traveling, because this will lead to non-essential travels and it will expose people to unnecessary risk. Each country will have to manage the situation according to their laws and their health systems. We don't have a recommendation for this vaccination tourism. This is a completely different situation from migrants. Migrants, I repeat, must have access to vaccines. Thank you. Thank you very much, Doctor. And the next question is from Jaime Cárcamo from Criterio in Honduras, and it reads, what are the factors that have led to an increase in COVID-19 cases in Honduras? And It says that cases continue to increase despite measures. And what are the projections of contagion for the country? Dr. Aldeguerri, please. Thank you very much for the question from Honduras. Honduras, on February 13, reported over 59,000 cases reported and more than 3,800 dead due to COVID. During the last week, we have seen positivity rates and death rates which are higher in some departments as Islas de la Bahia, in Cortes department, Francisco Morazan, and Atlántico departments as well. It is important that to consider that we are seeing a mosaic of patterns of transmission of the pandemic in Central America. Honduras in the last few weeks has seen an increase, and there are several factors explaining this. We see two factors mainly for this increase in Honduras. First, there are still some people and families that have been displaced and are in the northern part of the country, which is more widely affected by ETA and IOTA in 2020. These were natural disasters of an enormous magnitude. Those storms have also impacted the primary health care network, and so we are seeing this effect. The second factor is that Honduras, at this point in time, is going through a pre-electoral period during which we have seen there's a high risk of relaxation of the public health measures established by the authorities. What is important is not the existence of one single measure. Key as, for example, the national curfew that is in place, but the importance is to strictly and in a disciplined manner to have physical distancing, avoiding crowds, limiting numbers of people in an enclosed environment like malls and other businesses, and crowds and families, clearly respecting established rules by the national health system. Those measures work when they are strictly applied in a controlled and sustained way. I would also like to talk about the support of our office in Honduras and their support in all aspects of response to the COVID-19 pandemic, including this week of mobilizing lab experts to support the strengthening of the national surveillance network. I hope I have answered your question from the colleague from Honduras. Thank you. Thank you very much, Doctor. Now, as a follow-up to from Honduras, will they have enough vaccines under the COVAX facility leading to a decrease in contagion? Dr. Barbosa. Yes, thank you very much for your question. Many of the people are looking for this response. There is an estimate that is yet to be confirmed in real life, and that we would need to vaccinate at least 70% of the people to have control of transmission guaranteed. Others speak even up to 90%. So the vaccine that is being used at present has the purpose of saving lives, not controlling transmission. At this point in time and in the next few months, we need to maintain all measures that we know that we have evidence are effective to decrease transmission, like, for example, the use of masks when you leave your home to avoid crowds, avoid enclosed areas if they're not essential, avoid physical contact with other people, all these recommendations are effective, and we have a great deal of evidence that they do decrease the transmission capacity. So this is important that we remember we need to maintain these measures up until in all countries of the world we reach that vaccine coverage that is necessary. Because if a rich country, for example, were to achieve 70% coverage, but other countries don't have control, then the virus will continue to circulate. We will have new variants, and we will all need to work together very in a very well coordinated manner in the whole world. But the impact of vaccination on transmission will take time. The first objective, again, is to save lives, and it is important to save those lives. Later on, yes, we need to reach then that point of controlling transmission. Thank you, doctor. The next question is from Lara Pinheiro from O Globo, Brazil. The question is in English.
How does PAHO see the reopening of schools in Brazil, since we currently have virtually no restriction measures in place, no widespread testing, increased death and case numbers, and also the Manaus, UK, and South Africa variant circulating, and also not enough vaccines? Dr. Ugarte?
Thank you, Dr. Lara, for the question, because it also applies to many other countries beyond Brazil. But specifically with Brazil, with the beginning of the pandemic in Brazil in March last year, an estimated of 44 million students were away from the classrooms for many months. And in view of the conditions for the continuity of learning at home in Brazil and in most countries in the Americas, keeping schools closed for a long period of time can further aggravate the learning inequalities, but also other issues, particularly in the populations that are living in vulnerable situations. And we need to recognize that schools are part of the community and that measures taken to reduce the risk of COVID-19 transmission in communities will also reduce the risk in schools. So prioritizing the safe reopening of schools and ensuring the right of the children and adolescents to education are essential actions that the countries are looking very carefully. But this reopening must be done safely, preserving the health of the children, adolescents, and the education professionals, and also of their families. In the context of intense transmission of COVID-19, the reopening of schools must be carefully considered, taking into account other community-wide measures. Also, we need to recognize that in order to reopen the schools, we need also to maintain the public health measures that we have been emphasizing for a long time. Physical distancing, using of masks, hand hygiene, and several other measures. So the schools must be adequately adapted to reopen in those conditions. If we don't do that, we may see an increase of transmissions at school and, of course, increasing the risk all over the community. But it is essential then to evaluate the situation of each community, each municipality, each state, and take the decision based on that risk assessment. It is essential to reopen schools, but it is also essential to keep the COVID-19 at bay. And I would like to emphasize that the work of the member states have been done in collaboration with PAHO, with UNICEF, UNESCO, that have been worked together in most of the countries to provide support to the education sector and the health sector in order to reopen schools. As I mentioned, this is also a critical measure that we have to take carefully. Thank you.
Gracias, doctor. También teníamos preguntas sobre escuelas.
Thank you very much. We also had some questions in connection with schools from Jamaica and from other journalists. So now I would like to give the floor to Melina Ochoa from UNO TV in Mexico for her to ask her question. Melina, you have the floor. Good morning to all of you. Can you hear me? Yes, please go ahead. Very well. This is Melina Ochoa from TV in Mexico. This morning, before the Security Council at the United Nations, our foreign affairs representative indicated that some of the nations are having vaccines in excess. Do they think that these overstocking of vaccines by some countries could be a problem and also hinder access to vaccine through COVAX? Thank you, Melina. And also we have a similar question by Gisela Salomon and from AP, the same question. Dr. Barbosa, could you answer? Thank you very much, Melina. I think that our director in her opening remarks has already drawn attention to this topic. It is very important what Mexico has pointed out, and I think that other countries should support Mexico in this initiative, and this should be an important reflection because the truth is that there is no mechanism or there was no established mechanism to guarantee equal access to PPE and to the PCR test as well as to vaccines or medicines. This is a failure in the world's preparation to face a pandemic. In 2011, at the World Health Assembly, an important policy was approved, but that is specific for a flu pandemic that is known as EPI. That is the preparation plan for a flu pandemic. But in case of a flu pandemic, the vaccine producers need to donate an amount. They need to sell another amount at an affordable price. Why? Because the vaccines, the flu vaccines, as well as all the other vaccines in the world are produced with data, with viruses that come from the surveillance labs in the public health sector. That is to say, the labs that are maintained by the ministries of health in the various countries. This was used for the flu epidemic, but not for the other epidemics. And I think that this is the right time for the world to think whether it would be a good idea to have a facility such as COVAX as a permanent facility with rules and the funds that it needs to draw all of the agreements with producers to guarantee equal access. Because what happens? COVAX is a new facility. When it was created, for a couple of months, they needed to request donations and also to convince countries how the countries could participate. That took months. And during these months, since there are no rules, the producers started to enter into agreements with countries that had the funds to enter into those agreements. So I think that undoubtedly it is important, this call by Mexico, and PAHO has always stated that international solidarity, coordination, as our director already mentioned, is the best effort we can make. And I think that it will be very important to think about this and see how we can address other situations of pandemics and also address the situation with funds, with transparency, with rules, so that all of the countries have equal access to vaccines and other tools to respond to public health emergencies. Thank you, Doctor. The next question in English is by Kadeen Joseph, head editor.
In Antigua and Barbuda. He says, can you explain the concept of efficacy as it relates to COVID-19 vaccines, since there has been recent questions about the efficacy of the AstraZeneca vaccine compared to others like Moderna and Pfizer, which have over 90% efficacy? What makes the AstraZeneca vaccine still a viable option for countries like Antigua and Barbuda, despite its efficacy being lower than other brands? Dr. Barbosa?
Thank you for this question. You know that you can find a very detailed document. This document with its annexes and tables has around 50 pages. This is the recommendation from the Strategic Advisory Group of Experts of the World Health Organization. This is a group of experts that makes recommendations for all vaccines that we use in the world. This committee had a meeting last week. They reviewed very carefully all the data that were published about the AstraZeneca vaccine and make a clear recommendation that we should use this vaccine. Let me tell you that it's not recommended to make this kind of comparison between different methodologies that the producers used to assess the efficacy. The general efficacy of the AstraZeneca vaccine is around 63%. It means that when we compare the data, people that received the vaccine, and people that received the placebo, people that got the vaccine from AstraZeneca had a reduction of 63% of the incidence of the infection due to COVID-19. So this is a very good efficacy rate. It was estimated at the beginning that any vaccine that could reach over 50% could be used is a useful vaccine, and the AstraZeneca has 63%. So it is recommended, it's a safe and efficacious vaccine, and all the countries that will receive the vaccine need to guarantee that they can reach, in the first phase, all the vulnerable groups, and second, to achieve a high immunization coverage so they can control the virus in the near future. Thank you for your question.
Gracias, doctor. Siguientes preguntas es
Thank you very
sobre...
much, Dr. Barbosa. The next one has to do with variants. Two questions. One is from Kaylee Romero from El Confidencial in Nicaragua. She's asking whether PAHO has any trustworthy information to identify the variants in Nicaragua. And Pamela Fuentes from CNN News asked what countries are more of a concern for PAHO in connection with the variant. Dr. Aldiguieri. Thank you very much, Sebastian, for those questions on the surveillance of variants of the SARS-CoV-2 virus in the region. As I have in earlier press briefings, and also as we heard in the remarks by Dr. Etienne last week, there is a genomic difference of the virus in the Americas, with basically in two groups of countries. Group 1, countries that have national capability for the sequencing of the virus to study the genomic aspects of the virus, and those countries are 11 in the Americas. And the second group of countries include those countries that do not have genomic sequencing capability. However, those countries have the ability to send information to two reference labs in the region, Fiocruz in Brazil and the Public Health Institute in Santiago, Chile, with the support of PAHO. And it is with this very active participation of the countries that 3 variants of concern at international level have been sequenced in 20 countries of the region. In the case of Nicaragua, because the first question was in connection with Nicaragua, the country has not reported the capacity, the capability they have to sequence the virus genome. However, I would like to underscore that in Nicaragua, the Reference Diagnostic Institute does have a PCR diagnostic tool that is clearly established. So within this context, the PAHO team in Managua is stands ready to support the institute and send the samples to the reference labs. If you allow me, I see the second question in the chat, and I see it in English, so I will address it in English.
The worries of the variant in the region. So the direct answers would be one, that we are of course concerned regarding countries where the level of transmission is high and where public health measures are not strictly implemented. When the number of cases is increasing, the risk is that the likelihood of emergence of new mutations is higher. And the second worry that as a regional coordination body for the genomic network is that when countries are late for detecting an upsurge of cases and therefore late for characterizing the genome of the virus strain circulating in these countries, a delay in characterization and implementation of strict public health measures may cause an increase in impact on health services, including intensive care units for managing critical patients. So I hope that I have been successful to answer the concerns of both journalists from Nicaragua and for the regional aspects. Thank you.
Gracias, doctor. Siguiente pregunta es de Carlos
Thank you,
Serrano.
doctor. The next one is from Carlos Serrano, BBC World. Carlos, I will be giving you the floor for you to ask your question.
Muchas
live.
gracias.
Thank
Buenos
you very
días. Carlos
much.
Serrano
Good
desde ese
morning,
mundo en
Carlos
Miami.
Serrano from BBC
Mi pregunta
News
es
in
qué
Miami. My
información
question
tiene
is, what
PAHO
information
sobre
does
el
PAHO
avance y los
have
desarrollos
as to the
de 4 posibles
progress
vacunas fabricadas en Cuba,
behind
especialmente
4
la
vaccines
Soberana
that are
2, que entiendo que está más
supposedly being
avanzada,
manufactured
y con
in
base en
Cuba,
qué
such as Soberana
información
2,
la
which
OMS o
seems to be
PAHO
the most advanced, and
tiene
also
su posición respecto a
whether PAHO has
esta vacuna.
a position
Gracias.
already taken in connection with this vaccine. Thank you, Carlos. Dr. Barbosa, could you please address this question? Thank you. Thank you very much. It is very important to have in the Americas experimental vaccines. We have others in Peru, Brazil, and in other countries in the region. I think it is very important, and this also shows the technical capability that the region has to develop vaccines. We even had the opportunity to have some experimental projects in Brazil as well as Cuba to have them contact CEPI. CEPI is the tool that we're using for emergencies that coordinates research for the development of the vaccines, because CEP has some funds to support this type of development. We did establish contact so that the researchers could report, provide the information, and for the information to be analyzed. It is very important for the vaccines to be safe. We understand that Soberana 2 is coming to the end of stage 2, so all of the vaccines need to comply with all of the requirements. They need to comply with phases 1, 2, and 3. They also need to have the regulatory authority within the countries where their use is being attempted, and also to be able to be part of COVAX. The vaccine needs to be pre-qualified by WHO. So all of the vaccine producers that have already concluded phase 3 and that have also requested information or authorization to WHO requests information. Some of the producers have already sent their files with information, but all of this has to be completed through the various clinical trials to make sure that the vaccine is safe and efficacious. So the higher the number of producers that we have in the world, including in Latin America, that's good news, but they need to comply with all of the requirements. Only after we have the assurances that the vaccine is safe to be used. Thank you, doctor. The next question is by Alina Diestre from AFP France.
Y sobre Venezuela.
Friends, and she says, in connection with Venezuela, whether the country has already paid to have access to the vaccines that have been reserved through COVAX, what is the dollar amount to be paid by Venezuela to have access to the vaccines, and whether we look at the total amount, the total number of vaccines to be received by the country, what is that number? And she also wants to know whether Venezuela is the last country out of the region that is hoping to receive vaccines through COVAX. Out of the countries that are paying for the vaccines, she would like to know whether this is the only country that has had financial difficulties to pay, or otherwise, what are the countries that have had some difficulties? Dr. Ugarte, yes, I may address the issue of Venezuela, and I think that Dr. Barbosa can supplement my answer. Yes, indeed, the negotiations and the conversation with the various academic, political actors and scientists have led to the creation of the National Technical Table for access to the vaccine through COVAX. That first meeting took place last week, and it was useful to set the basis, the principles on which an agreement would be reached. And one of those was the mobilization of resources to make the first payment to have access to the vaccine through COVAX, through the revolving fund that PAHO has. As you all know, in the Americas, the revolving fund for vaccines is the mechanism that allows countries to have access to the vaccines through COVAX. Now, as to how much they need to pay, they have an advance payment of $18 million. That's what they need to secure the supply of vaccines. The number of vaccines that they would immediately receive depends on the availability and also on the progress made in Venezuela in connection with all of the aspects to be able to implement vaccination. That includes legal, operational aspects, as well as logistical aspects and training of staff, cold chain, etc. In that regard, PAHO and UNICEF are working with all of these actors to speed up the processes, and once the first payment is made, Venezuela would be available to receive vaccines through the COVAX facility to implement vaccination through the vaccination plan to be approved. The next meeting will take place this week, and during this meeting, there will be more details, and the public opinion will be informed based on the topics and also the specific agreements regarding financing, vaccination plan, etc. Thank you very much, Dr. Barbosa. Thank you, Cito. All of the countries that are participating in COVAX in the region make up two groups. On the one hand, we have the 10 countries that will be receiving the vaccine without the need to pay, because those vaccines were paid through the donations made to COVAX, and they are 10 in this region, and the other countries do need to pay for the vaccines. We know that it is an important effort for all of the countries to make, and we have also been having discussions with the financial institutions, with the World Bank, the Inter-American Development Bank, as well as other institutions. Our director had a meeting with the new president of the IDB, and the banks are offering to support to several countries in the region. They're offering special loans for the acquisition of the vaccines. So we are currently supporting the countries not only in connection with the technical details that need to be ready to accept the vaccines, importation, regulatory issues, and also the preparation of surveillance after using the vaccine, the post-market surveillance, as well as the cold chain. We are supporting them, but we're also looking for options, alternatives to support the countries. For example, in the case of some Caribbean countries, CAFTA and also the European Union reached an agreement to financially support those countries. So we are looking into the individual situation of each country to find support so that everyone can pay for their vaccines and receive all the vaccines they need to face the pandemic. Thank you very much, Doctor. The next question is from El Salvador, Jacqueline Villega from El Mundo, and also Beatriz Mejia from the Prensa Gráfica El Salvador. Jacqueline is asking when the first batch of vaccines will be arriving in El Salvador, since the president of the country has indicated that it would be in the first week of March. And Beatriz from Prensa Gráfica would like to know whether El Salvador has the proper infrastructure to guarantee proper handling of the vaccines, who would be vaccinated first, and she's also asking about the control mechanisms to prevent a vaccine gate so that these vaccines also reach first-line health facilities. Dr. Barbosa, thank you very much for these questions. The COVAX vaccines will be sent to the countries in early next week. They will be informed early next week the number of vaccines to receive and when. As of today, we do not have that information. Next week, we will be informing the countries, and this is a very complex exercise. COVAX has 192 participating countries. Therefore, everything is being arranged with the various companies, agreements are being reached, and this is also being arranged with the transport companies, and this is going to be organized with PAHO and UNICEF. PAHO and UNICEF are in charge of the acquisitions, so we have been negotiating with all of the producers and also those who are responsible for logistics and how the vaccine will be reaching the country. So the COVAX mechanism will be sending the information, the specific information, to all of the countries so that their immunization plans and schedules can be adapted. Many of the individuals believe that the vaccines are arriving through COVAX, whether they arrived or not. No, the COVAX vaccines have not been delivered yet. The countries that are administering vaccines and access is limited. Those are vaccines that are being administered because of bilateral agreements or because of the vaccine diplomacy. This is not COVAX. COVAX will be sending a letter to the countries indicating when and what they will be receiving, and this will be sent next week. El Salvador does have conditions to accept the vaccines. The countries in the Americas do have a very consistent tradition in immunization, and they have had several achievements in this area, but also we're working on a daily basis with the countries through our own offices, and in each of the countries and also from the regional level. For example, in 2 days, we have a meeting with all of the immunization heads so that we can analyze the latest provisions that need to be implemented to receive the COVAX vaccines. So we're working with all of the countries to have everything ready. It is a challenge. The countries need to continue to vaccinate against polio, rubella, measles, and also organize a parallel immunization campaign for children, because here we do have a very significant challenge, and we are working very hard with all of the countries. Finally, as to the vaccine gate, I think it is important for the countries to be able to monitor and also guarantee that the vaccines are being administered according to the technical criteria, also communicate in a transparent fashion with the population. I do not think it is acceptable to have vaccines that are not being used as part of the national plans. And the society is also supporting the work of the ministries by presenting claims or situations that are not completely regular so that we can have a vaccination campaign that reaches to those that need it most. Thank you very much, Dr. Barbosa. And in that regard, I have a question in English from Pamela Fogg, CBS, who says,
Is being included in vaccine drives? Dr. Barbosa?
Yes, thank you for this question. This is very important for many countries in our region. Yes, we have recommended, and in many countries in the region, they have the indigenous population as a priority group. Of course, that you need to go in each country. We have some specificities. In some countries, we have indigenous population that are more integrated in the big cities. In other countries, we have indigenous populations that have difficult to access health services, so they need to develop specific policies to reach out these communities. But for the situation that they live, when we have an outbreak of a disease that is like COVID-19 and other diseases, we can have a very important outbreak among indigenous population. They can also develop severe diseases, and the data that you have are showing this. So yes, they need to be considered, they need to be part of the population, and look in each country how to guarantee their access to the vaccination when the vaccine is available.
Muchas gracias, doctor.
Thank you very much, Dr. Barbosa. One of the last questions that we have for today's press briefing is from Marta Guerrero from Mexico. She's saying that WHO also indicated that the level of transmission is at its lowest level in 6 months, and she's asking how much has it been reduced in the Americas. Dr. Aldigueri, thank you very much. I'll try to be as brief as possible. Clearly, we hear news globally about an important decrease in the number of cases in the region of the Americas. What we are observing throughout the hemisphere from the north to the central part and the Caribbean and south is that, again, we are at the level of transmission that we saw 12 and 13 weeks ago. That is to say, in the last quarter of 2020, we see a constant decline. But in connection with numbers of deaths reported, we have only seen over just 1 week that we have seen a decline, a decrease in the number of deaths. So there is a difference in the numbers. In both cases, new confirmed cases and new deaths, the decrease in the reporting is related to a decrease in the reporting by the U.S. This is what takes us to this decreasing trend in the hemisphere. I hope I addressed the question by our colleague from Mexico. Thank you very much, Doctor. We are reaching the end of our press briefing today. The last question is by Blanca Valadez from Milenio in Mexico, and also other journalists had similar questions as to the number of health workers that have died in the region as a result of COVID-19, and also how the increase in hospital admission has an impact on health workers in the region. Dr. Etienne.
So let me thank the journalists for this question. And I always say, God bless our healthcare workers. All healthcare workers have made extraordinary personal sacrifices to care for patients who have fallen sick. And they've had to work harder and longer under more grueling circumstances than ever before. And as hospitals became overwhelmed, they were put in what was an unenviable position for any healthcare worker to watch as patients died because of lack of beds or lack of access to equipment. No health worker must be put in a position to have to make a choice of life and death. Many have risked their own lives and those of their families to care for those who are sick, and their heroic efforts have saved many COVID patients. Although there's limited data, we know that more than 1 million health workers in our region have become sick with COVID-19. And we know that at least 6,000 of them have died as a result. Now, most of that 6,000 were women. Let's say that we owe a great debt to our healthcare workers, many of whom are unsung heroes. And PAHO salutes healthcare workers across the Americas and certainly globally. We have supported our healthcare workers by sending hundreds of thousands of kits of personal and protective equipment, supplying equipment and materials for laboratories, and providing training materials and guidance for healthcare workers, and doing actual training for healthcare workers. And so that is why we insist that the first deployment of vaccines should go to those most vulnerable, like our healthcare workers and the elderly. They are more at risk for severe forms of COVID-19. And we believe that this is both the right and the smart thing to do. Doing so will allow us to have a greater impact, preventing hospitalizations and deaths, protecting healthcare workers, and reducing the strain on our health systems. And let me make an appeal again. Please, let us each do our part to reduce transmission and stop the pandemic. Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.